Anything that can happen to blood vessels throughout the entire body can happen to the blood vessels in the back of the eye. And usually it happens to those blood vessels first because the back of the eye has some of the smallest and most fragile blood vessels throughout the entire body. Patients who haven't seen doctors regularly that come see the eye doctor, we often pick up high blood pressure, high cholesterol, and diabetes. Although we would prefer the primary care doctors to pick those type of diseases up before we actually see damage in the back of the eye. A few common retinal findings that we often see are freckles in the back of the eye. And there's two types of freckles: chirpy, or congenital hypertrophy of the retinal pigment epithelium, or nevus. Those are just freckles in the back of the eye. However, if they change, it could be something scary like a melanoma. Something else we often see in the back of the eye is macular degeneration. And there are two types of macular degeneration. The dry form of macular degeneration is when there's lipid or fatty protein deposits in the macula, where you get all of your detailed vision. The treatment for that is just AREDS2 vitamins, and AREDS2 is a formulation or a combination of vitamins. And it must be number 2 because AREDS1, the initial formula, originally had an increased chance of lung cancer. So make sure if you have macular degeneration, you're using AREDS2 vitamins. The second form of macular degeneration is the wet form of macular degeneration. And the wet form has a different treatment. It's injections into the back of the eye. Now, no one wants to have an injection into the back of the eye. However, before these injections, about 10 years ago, there was nothing we could do for wet macular degeneration. So it really has been a miracle cure.